Hello friends, my name is Ankit. I make educational videos on US healthcare. I also write blogs on US healthcare trends. I'll leave the link below in the description for your reference. If you are new to my channel, welcome. Please click the like and subscribe button so that you have access to all the latest feature content. In the current video, we'll talk about challenges with the prior authorization system. Those of you who are new to US healthcare or who do not understand the prior authorization, there are two different workflows that we are talking about. In first workflow, as a patient, you go to your primary care physician and he needs to refer you to a specialist or he needs to prescribe a specialty drug. In that scenario, the primary care physician would have to submit a prior authorization request to the payer or the health insurance plan. The health insurance plan takes its own time. It could be weeks before they take a decision. If the decision is the approval, and if it is a prior authorization for prescription, the pharmacy will go ahead and issue you the prescription. If it is a prior authorization request for the specialist treatment, only if it is approved, you are covered by the health insurance for any treatment provided by the specialist. Now, there are different challenges with the prior authorization request in a new survey by the American Medical Association, also known as AMA. 95% of the physicians reported that prior authorization demands cause care delays, and 79% said patients abandon treatment because of authorization issues with the insurer. The survey was conducted in December of 2020 and covered 1,000 practicing physicians. The other key findings of the reports were 90% of the physicians said that PA program have a negative impact on patients' clinical outcome. 30% reported that PA requirements led to serious adverse events for patients in their care. 85% said that burden associated with prior authorization were high or extremely high. Only 15% of the physicians were positive and reported that PA criteria were often or always based on the evidence-based medicine. How does prior authorization impacts the timely treatment or clinical outcome? Let's say a patient receives a cancer diagnosis. Understandably, the patient wants to start treatment as soon as possible. The oncology team determines that radiation or surgery or chemotherapy is the best option and submits a request to the physician's primary insurance company for prior authorization to approve the treatment. With luck, you get a quick approval, but for various reasons, you might also receive a denial. Perhaps the insurance company is not sure that the proposed treatment is the best option or prefers what looks like a less expensive option. Oncologists increasingly are restricted from exercising their expert clinical judgment in determining what is the best interest of their patient, yet they are held accountable for the treatment outcomes even in the situation when care decisions have been taken out of their hands by the health insurance company's peer reviewers who are reviewing the prior authorization request. These peer reviewers are frequently not cancer specialists and therefore often unfamiliar with the modern cancer treatment. Insurance companies may initially deny a request only to reverse the decision upon appeal. For doctors, that means additional time spent on phone and filing paperwork. And nothing is free. The doctors do charge for the prior authorization to the patient. Based on my personal experience, I always end up paying close to $25 for the prior authorization request submitted by my primary care physician, irrespective of whether that prior authorization request is approved or not. For patients, the delays could mean days without access to the potentially life-saving treatment and the additional stress that comes from not knowing what comes next. The American College of Rheumatology in 2020 made several recommendations to reduce prior authorization requirements and improve access for the patient. The recommendations included reducing the number of clinicians subject to prior authorization requirement if they are following evidence-based practice, reducing the number of services and medication that require prior authorization, improving transparency and channel of communication between payers, patients, and clinicians, protecting continuity of care when changes occur in coverage, payer, or prior authorization requirement, accelerating adoption of national electronic standards for prior authorization. Still till date, prior authorization has been a challenge. The health insurance companies, they have to manage their expenses. And the best way to go about is anything which is considered a unique treatment. anything which is considered expensive. They want it to go through the prior authorization process. The number of prior authorization requests are huge. It takes them at times weeks to come to the decision, which causes delays in the clinical outcome or the treatment for the patient. There is a renewed focus nowadays on finalizing the electronic prior authorization process to streamline the prior authorization and improve the data transparency for payers, providers, and patients. In the coming video, we'll talk about the electronic prior authorization FHIR standard, which is based on Burden Reduction Act. We'll try to get to the bottom of it on how industry stakeholders are trying to collaborate to overcome this complex problem, not only just to improve the clinical outcome, but also to reduce the expenses on the prior authorization process. If you like the content of this video, please hit the like and subscribe button. If you prefer me to come up with videos on specific topics, please comment to my video. Until then, see you next time. Have a good day.